Welcome to Wellness Wednesday. We are here again with Nick Hope inside the Facebook group Brain Wellness and Dementia Prevention. And Nick is back for the second time. We are so excited to have him back again. Hi, Nick.
Hi, thank you for having me back.
If I had you back in like a month from now, I would be able to call you Dr. Nick Hope. So we're
Yes,
very excited for you.
thank you.
So for those people in the group who have not met you before, seen you before, tell
Mhm.
us a little about you. I can read a little bit about you first, and then you can jump in from
Sure.
your perspective. Okay, so Nick will graduate from the Philadelphia School of Osteopathic Medicine with a PsyD in clinical psychology very soon this summer. His main areas of interest are in diagnosis and prevention of dementia through non-invasive pharmacological means. He hopes to dedicate his career to helping patients and families dealing with such diagnosis, including ways of delaying and preventing dementia altogether. This has been a wonderful group to work with, and he loved his short time. Well, maybe it's a longer time now because we had this same introduction a year ago, but you at that point were really enjoying working with this group, and I'm
Mhm.
sure you have more good stories to share. So welcome again,
Yes,
Nick.
thank you.
So what's been going on the last year since you joined us last?
Yes, so we completed the entirety of the study. So we did the recruitment, we collected all of the data, actually ran the intervention, collected all of the data afterwards, analyzed it, wrote up the dissertation manuscript, and defended it. All while also being on my pre-doctoral internship, also working within the geriatrics and dementia population.
Fantastic. So for those people who are not familiar with how a research study goes, can you break it down for us? So what was the design? How many people were involved?
Mhm.
Um, why
Yeah,
you chose the
so
topic area?
yeah,
Yeah.
absolutely. I think that that's a really good place to start. So there is a lot of research out there that focuses on different areas that are protective of the brain against things like Alzheimer's and other forms of dementia. But there's actually very little out there that consolidates a lot of those different factors. So these studies look at sleep alone, exercise alone, diet alone, but there's very few that integrate a lot of different aspects of lifestyle, which was really what we aimed to do in the study. So that was really what kind of inspired a lot of what we did and how we formulated the study to begin with. Seeing different areas that we know are protective against Alzheimer's and other forms of dementia by themselves to see, how we can consolidate that together. That way people aren't going through 20 different interventions with the same goal in mind. So that was kind of a years long process to kind of get an idea of how we really wanted to work around the study, and ultimately led to the actual planning of our study, which involved recruiting 25 participants to engage in a 7-week, what we call motivational cognitive behavioral therapy program that looked at different lifestyle factors. So things like diet, exercise, stress, among others, and seeing if we were able to enact that behavioral change that we see, or at least that we were hoping to see, followed by the motivational cognitive behavioral therapy regimen that's been proven with other types of modalities.
Right. So I'm assuming in your literature review you came across Dr. Dale Bredesen.
Of course.
Yeah. So I'm almost finished the Recode 2.0 um, practitioner and health coach training. So I'm very excited about that. And that is exactly, you blend so well with everything that he is trying to do because he spent so much time in the lab trying to develop the single magic bullet to cure Alzheimer's and spent 2 decades, you know, figuring out that that's not going to happen, that you have to do lots of things all at the same time. But it's so hard to study that. So
Mhm.
in every study, it's an N of one. So
Yes.
with this one person, we did all these things, and we were successful. But I don't know of another person who has done something like you did. So I'm very excited to see and hear from you how it went. So
Yeah,
break it down.
absolutely.
Yeah.
Yeah, so unfortunately, just because I am a student and don't have the resources or funding or time of a major institution, we really had to pick and choose what factors we were going to focus on. And again, it was really based off of the strongest literature that was out there to make that case. So we ultimately ended up having 7 major hypotheses or things that we wanted to test out. So the first was cognition, whether or not we saw any change in performance on a cognitive measure. And our hypothesis was actually we wouldn't see any change. Ideally, we just simply didn't want to see a decline.
Right.
And really, the mentality there was that you really can't change cognition over a short period of time, like 7 weeks. But what was really fascinating with that first hypothesis is that when we examined all of the data afterwards, we were actually very close to a statistically significant change. Our cutoff
Wow.
was a 0.05, and our mean score is a 0.052. So we were essentially off by 0.02 of being significant. So we
In
can't say that
seven
we had a
weeks.
significant, yes,
In 7 weeks, cognitive change.
yes. So again,
Wow.
it wasn't statistically significant, but
Right.
it shows promise. And
Yeah.
especially if we increase the number of participants, there's a good chance that we could have gotten to that number. So I think it does lead a lot of promise to future research as well, where they might have more resources and time to recruit a much larger sample size.
Yeah. So how big was your sample size and what qualifications did they have to meet the criteria to participate?
So we ended up recruiting 25 participants that went through the formal informed consent procedure. 21 ended up actually taking part in the pre-test data collection. So before we did any of our intervention, and then another over the course of that 7-week period, we lost an additional 6. So we ended up with 15 participants that completed both the pre-test, the entire intervention, and the post-test data collection.
That's fantastic. And like you said, this is a great study for somebody else to pick up
Yes.
and do it again in a bigger group.
Mhm.
So tell us about the interventions. And I wanted to ask, are these people a wide age range? Did they have
Yes.
history of Alzheimer's in their family? Who qualified?
So we used essentially a diagnostic screening tool called the K Dementia Risk Scale, which was developed in Finland. It was used by another study, which we based our study very largely off of, called the Finger Study.
Mhm.
And that looked at things like hypertension, obesity, your age, whether or not you smoked, your cholesterol, and ultimately calculated a score. Our cutoff score was a 6. And ultimately recruited individuals that met that criteria. Our other inclusion criteria was that individuals had to be between 40 and 60 years old. Uh, the main reason for that being that we really see the physiological changes with Alzheimer's at that age before you start seeing those outward symptoms like the memory loss, the language difficulties. The actual biological changes to the brain that you see with those types of diseases actually start occurring 15 to 20 years before the outward symptoms occur. So that was really our goal, to try and nip it in the bud before essentially that things really started to cascade.
Right. I'd like to repeat that for the audience so that people can hear that and take that in, that the brain changes, the physiological changes that can be detected in tests occur over a decade. So you said 15 to 20. I've heard 20 to potentially more than that.
Mm.
We know it didn't happen yesterday. So
Yes.
there's a long time that we have to intervene and protect the brain to reduce our risk long before symptoms appear.
Yes.
Yes. Okay. Fantastic. So what did you do for your pre and post tests? What were your cognitive tests?
So we used the Montreal Cognitive Assessment for a number of reasons. One, it was quick and easy.
Mm-hmm.
And two, it was already adapted to a telehealth format. Given the COVID-19 pandemic, we essentially had to uproot the entire study. When the original intention, when we started planning this back in 2018, was to have it in person. That was just obviously not feasible. So we had to find a measure that was already well validated and utilized on a telehealth format. And the MoCA had really, really great evidence and already a standardized protocol to doing that. So we really decided to utilize that in the study to measure cognition.
Right. So did you have people that were with mild cognitive impairment in the study, or no?
No. So these were cognitively healthy individuals.
Okay.
Again, we wanted to really just kind of develop a baseline and get an idea of where things were. I think it does provide a lot of promise to future studies with individuals in that stage. But again, we were looking at individuals in that really early stage between 40 and 60 years old. It's very, very unlikely to find individuals that meet the criteria for a mild cognitive impairment that early on in their life.
Right. Right. Okay. So you did the MoCA pre and post. That was the cognitive
Correct.
testing. Okay.
Yes.
Okay. And so what you were talking about, the 7 hypotheses, the 7 areas of intervention. Can you talk about
Yes.
those?
Yeah, absolutely. So every single week focused on a different intervention. So the first week was simply an introduction where we, talked about the program, provided some education on dementia, a little bit about what the program would be about. And then week 2 through 6 really focused on specific areas of brain health. So week 2 focused on exercise, week 3 focused on sleep, week 4 focused on diet, week 5 focused on stress, week 6 focused on kind of miscellaneous lifestyle factors like managing your health through, managing your high cholesterol or hypertension or your weight, etc. Kind of like this miscellaneous health education portion. And then the 7th week was kind of a closure and talking about maintaining the behavioral change long term. And then obviously collected the post-test data collection right after.
So what did the groups look like? You were telehealth, I guess. Were you meeting together in a group?
Yeah, so everything was held entirely over Zoom. So we held all of our intervention sessions in one giant group session over Zoom, where individuals were able to kind of collaborate in a group therapy setting as if it were in person. The only difference was that we were behind a screen.
Yeah. So for those people that don't know what motivational interviewing or cognitive behavioral therapy is, can you explain a little bit about that?
Mm-hmm. Yeah, so motivational interviewing is essentially a way at helping an individual realize what values they hold most, dear to them and what really they place the most weight on in their identity, in their decisions, in how they formulate themselves as a person, and using those values to change some type of behavior for the better, whether it's a physical health goal of losing weight, eating healthier, improving your cognition, or a mental health one of, being more patient or less angry or less stressed. While cognitive behavioral therapy is really focused on helping an individual understand how their thoughts, their feelings, and their behaviors are all interconnected and helping them understand how each of those influences the other and how they're all kind of tied together into essentially understanding their mental health and how they can impact their outlook on the world.
Yeah. So I'm not a therapist. Well, I am. I'm an occupational therapist,
Yes.
but not a clinical therapist like giving therapy like you're doing. But I went through a health coach training, and a large part of the focus was on motivational interviewing. And when I was sharing what I learned with my teenage daughter, she decided that I should parent using motivational interviewing at all times, which I am not successful at just yet, but I do try to use it in scenarios when someone is ambiguous about wanting to make a change. So, yes, I know I should eat healthier, but I really like McDonald's fries and Coke and a chocolate cake. So when you're kind of stuck between wanting to do something and struggling to do that, and what we were told in this training for motivational interviewing is that when someone is in that place of ambiguity, when you tell them what to do, they are much less likely to do it. Yes. I was like, oh, that takes away the parenting of do this because I said so.
Yes.
Right. So as a therapist, you're trying to pull out, move from one place of readiness for change to the next. So being almost ready to think about wanting to change to starting to
Mhm.
take little baby steps to change.
Yes.
So, and cognitive behavioral therapy, again, my understanding as a layperson, not as a person doing therapy with CBT, but it gives you concrete things to take
Yes.
action on. It's
Very
not
much so.
just talking about your feelings, um, which is another kind of therapy, which can be helpful
Yes.
in some
Mhm.
scenarios, but this really gives you actionable steps to take. Um,
Yes.
Lots of evidence behind CBT as an effective therapeutic intervention. Am I
Yes.
right? Correct me if I'm wrong,
No, no,
because
absolutely.
okay,
You're spot on.
okay, okay. Um, so, what was most surprising to you in your research?
I think the most surprising thing was the cognition and how we saw that much of a dramatic change. But aside from the cognitive aspect, which we obviously already talked about, was really how much people were invested in the program, and that they were, very passionate about the dementia prevention, and they really bought in quickly. That's something that I was really shocked about, and I think that, in hindsight, I, discussed this in my discussion section where, we, thought about, the type of population we recruited from. And these were individuals that most likely already had a high level of motivation to do so. With that being said, though, it's very difficult to change a lot of old habits that you might have had, years or decades of ingraining into yourself. So I was very surprised at how much people bought into it and how passionate they were in discussing that change talk.
And what kind of feedback did you get from the participants? Were they making daily and weekly changes?
Yeah, so I mean, the feedback was overwhelmingly positive, which is obviously wonderful. And I think that one of the things that they said was really helpful was the weekly check-ins and the weekly aspect of the program, not only by, us, just checking in once a week prior to the therapy, just saying, is there anything we could do to help, but also in the therapy allowing us and the group members to help problem solve and listen to any concerns and come up with innovative ways of addressing any barriers that might have gotten in the way of somebody, eating, healthy that week or exercising the amount of time that they wanted to exercise, etc.
Yeah. And recently there has been some evidence showing that group health coaching sessions are really helpful for people, more
Yes,
helpful than one-on-one, because
absolutely.
exactly what you just said happens and people support each other and you learn something from somebody else when they share a story, and it might hit you differently than if it was
Yeah,
just a one-on-one interaction.
yeah.
um,
No.
and
I do
maybe
apologize. I'm
go
just
ahead.
gonna take myself off a video just because my battery's dying a little bit, so
Okay.
I'm gonna plug myself into the charger.
That's
I
fine.
am still very much here. I don't want to be
Okay.
rude. I just wanted to not die on you.
Okay, thanks.
Yeah, but
um,
yes, I'm still here.
okay, good. Glad you're still here. Um, I'm going to lose my train of thought now. Oh, that maybe it was helpful actually that the group weaned down to 15, because that's kind of like a magic number for a group, I think. Like
Yeah, and there's a
27, or that's a lot of people to manage in a group.
yeah, and there's actually a lot of research out there that says kind of that sweet spot is, like that 10, like 15's really on the upper end of things. So we were very, I don't want to say aggressive because I don't necessarily know if that's the correct word, but we were very optimistic about our ability to handle that many participants. But again, we kind of had to play the cards that we were dealt, um, and had to really kind of acknowledge that, we didn't have the time to run multiple sessions of, 10 each. We had to focus in the realm of letting me graduate on time.
Right. Right.
But ideally, we would really like to break the sessions up, and that was something that came up in our discussion a lot. Was how are we going to make this the most convenient for individuals? And one of the things was talking about having multiple sessions at different times run by different facilitators. Just because that's something that really was one of the things that was brought up during these feedback and, you know, constructive criticism moments of the feedback sessions, where they were saying that, it could have been a little bit more convenient for individuals in the program.
Right. Right.
So I definitely think that that's something to do moving forward. And you bring up a really great point that 15 number was really good, at least for the group dynamic and the group cohesiveness.
Right. But if you were going to move this beyond a research study into real world, how would you design it?
I think that despite how wonderful telehealth is, I do think that there is aspects that we were missing in the group therapy format. By having a telehealth, I think that there is value added to the in-person modality. Just again, increasing that in-person kind of group cohesiveness there. So that would be the first thing. And the second thing, I really think that we would focus a little bit more on the interventions where we didn't necessarily see as much of a change, and trying to make that better for the individual. So, for instance, we didn't see a statistically significant change in depression or anxiety scores. And one of our big theories was that we grouped them into one lump session where we kind of gave an abridged version of both of them. And I think that, again, this is just theory, obviously, but it impacted the group's ability to really fully grasp the lesson, unfortunately. So we really wanted to, or really want to move forward, focus on those two interventions specifically, and really dedicate the time that's necessary in order to be successful in it.
Okay.
So I think that really moving forward, focusing on what's going to benefit the individuals the most, because some of the things were extremely successful. Individuals' knowledge of dementia skyrocketed. We saw a threefold increase there. Individuals' diet adherence really increased as well. So we want to stick with those things and try to build off of those more. But I really want to focus on the areas that we didn't necessarily see as big of a change in.
Right.
And again, the two most surprising ones being the depression and anxiety.
Right. So would you increase it to more than 7 weeks?
I would, yes. In hindsight, I think that 7 weeks was rushed, and I think that from a practical perspective, it was very good in a lot of senses that we were able to consolidate this and get the individuals the help that they needed. But in order to really kind of knock it out of the park, if you will, I think that increasing it to maybe 10 sessions instead of 7 could really benefit in some capacity.
Right. So did the sessions, were they designed just as a talking, or did they have handouts that they went away with, or things to read, or
Yeah,
how
so
was
that's
it
a really
done?
good question. So it was very visually formatted. So we had videos, we had handouts, we had different things for them to reference. But also in between the weeks, especially for, I don't want to call them homework assignments because I feel like that's a little bit patronizing because I'm talking to a bunch of 40 to 60-year-olds, but we call them action assignments, where they were doing things in between weeks in order to keep up with their goals. So they were given handouts, they were given kind of worksheets, if you will, that focused on that week's source material.
Okay, awesome. Yeah, it sounds phenomenal. So what are you going to do next, Nick? What are your plans?
So I will be completing my pre-doctoral internship on June 30th, which is very exciting. So I will essentially have officially completed all of the necessary requirements in order for me to have earned my doctorate. And then I essentially have the month of July off between my graduation and completion of my internship, where I'm really going to focus on some self-care, and also just preparing for my postdoctoral fellowship, which I'll start on August 1st. And at that program, I'll be working in a neuropsychology practice in South New Jersey, where I'll be seeing a wide range of patients, but also my big job will be starting up a geriatrics program there and trying to work on setting up an Alzheimer's and memory care clinic with them, which I'm very humbled and honored to have been given that responsibility.
Fantastic. Congratulations.
Thank you. I really appreciate it.
Yeah. So do you think that this project that you've done for your research will be part of the next phase? Will you?
Oh, absolutely.
Okay.
Um,
Good.
you know,
Good.
I don't necessarily know where the research um, is going ahead for me. Just I don't know what my life is going to look like within the next year. But even from a clinical standpoint, when I'm working with my patients and making recommendations for them, I use a lot of the research that I conducted to help formulate those recommendations for patients. So, increasing their exercise, increasing their cognitive stimulation, and eating a right diet. Those are all things that I really do try to, make sure that the patients that I see and I'm evaluating understand and know the true impact that it can have on their long-term health, even if they are getting a horrible conversation like a diagnosis of a dementia or mild cognitive impairment. There is hope there that in the worst case scenario that this is going to progress, at least it can progress at the slowest rate possible. And that's really the thing that gives me solace when I do deliver those bad news meetings is even in that horrible type of situation, there is still hope that you can delay this as long as you possibly can. And there is research coming out day after day after day. There's no shortage of Alzheimer's research going on right now. So that's the other really promising aspect too, is that there's no shortage of studies and people that want to find a cure and find a way to slow this down.
Right. Right. Well, is there anything else that you want to add about your study that we didn't talk about so far?
I don't think so. I think that you asked a lot of really great questions, and it really kind of encompassed a lot of what we found and also what we aim to accomplish in educating the community about why it is so important to adapt these lifestyle changes, excuse me,
Yeah.
to their cognitive health, because it really is going to benefit them long term. And again, from a motivational interviewing standpoint, really align with those values that they hold most dear to them, whether it's their family, whether it's their health, whether it's their faith. It will really help align with what is going to um, make them the most successful personally, physically, and emotionally in the future.
Yeah. And do you have a personal reason for researching this? What is your background? What led you to get your degree in clinical psychology and to study the prevention of dementia?
Yeah, so I was always really interested in psychology from the time that I was in college and knew I wanted to go into clinical psychology. I really didn't have an idea about even what neuropsychology was, even by the time that I started my doctorate. But I had a very close friend that was very invested in neuropsychology from the beginning that got me interested. And shortly thereafter, my mother was diagnosed with a complex form of dementia following intensive radiation therapy back in the early 2000s. So that really kind of ignited a spark, passion, whatever you want to call it, to really studying this and really diving myself in there, because despite it being kind of an unnatural cause, again, it being, full cranial radiation, there were other factors that still could have been done in hindsight to really protect her brain as much as possible that just personally I was not aware of, and really want to prevent, any families, sons, daughters, spouses from, experiencing that. So it is something that is, personally very, very close to my heart.
Right. I think let's both give a shout out to our moms today. So today
Absolutely.
was today would have been my mom's 81st birthday. She
Uh,
she died just before she turned 78, and she is my inspiration. I mean, she's why I'm doing what I'm doing. And she got diagnosed in 2003 um, with dementia. But now that I know the connection to inflammation um, and other chronic illnesses, she also had chronic fatigue syndrome, which
mm,
was diagnosed in 83. So when I was diagnosed with MS in 2006 and decided to um, take a year to address it nutritionally, my mom
mhm.
adapted the same diet and saw a dramatic improvement in her fatigue.
Yes.
And yeah, so We think that we probably really slowed things down because she didn't die till 2019. She was diagnosed in 2003. That's a long time with a dementia diagnosis.
Yes.
The only thing we changed was diet, but her energy level was so much better that she was able to be more active. So I wouldn't say she exercised, but she moved more after that diet change. And now we
Yeah.
know even more. So I'm excited that that we're sharing this with as many people as we can. How can people follow you? Are you a social media person? Um,
Admittedly, I am horrible at social media. I technically do have an Instagram. I don't even know my name, to be honest. But if you
okay.
look up Nick Hope, I'm on there. Any inquiries or if anybody wants to learn more, I am happy to talk with them because it really is a great, it really is something that, I'm very passionate about. They can reach me by email. That's definitely what I am most receptive to or responsive to. And that email is N as in Nick, H as in Hope, 257729 at pcom.edu. That's my school email, and that's an email that I'll continue on even after I graduate. So
Okay.
I'll continue to be using that email.
Good to know. That's hard to remember, but that's a good cognitive test for us all.
Yes, yes. I never understood why they gave such crazy emails.
I'll put it in the show notes. Are you going
Thank
to
you.
try to publish your study?
Yeah, so we are in the process of getting the manuscript proofread, just again as part of the regulations of completing the process. That will hopefully actually be submitted by Friday. And then once that's done, I'm probably going to take a little bit of time off because this has been my entire life for the past 4 years. But
Yeah.
ultimately, within the next year, my principal investigator and supervisor and I want to work on making those strides towards publication.
Fantastic. We wish you the very best of luck. We want to
Thank
get
you.
this published and out there so other people can read what you have done and expand on what you've done. So thank you so very, very much for being with us tonight, Nick.
Thank you so much. I really appreciate being here and I appreciate you reaching out and having me back.
Yep. We wish you the best of luck with whatever is next. Well, with the postdoc and family life and a month of self-care.
Yes, thank you. I appreciate that.
All right. Good night.
Have a good night.